In our conversation today, we are going to be talking about the why and how does that apply to your health. How the energy you put behind an habit that you want to start or you want to stop affect your ability to be able to stop that habit or to begin a new healthy habit that's going to impact your health. Hello, you're welcome to my channel. My name is Dr. Roberts. I'm a medical doctor and a lifestyle physician. Here on my YouTube channel, I share with you on strategy on how to adopt or to stop habits that affect your health positively or negatively. And if that is one of your goals, then you're welcome to the channel, and I invite you to subscribe on the button that's going to be coming up on down the video, and make sure you activate the notification button so that you can receive new video as I release them on this channel, both in French and in English. Okay, like I was saying in the beginning, today's conversation we're going to be talking about the why and how does that affect your ability to start a new habit and to start a new habit that's going to impact your health positively, or to stop habits that affect your health negatively. When we talk about the why, actually we are referring to the purpose of a thing. We are referring to the reason behind the thing you want to do. For example, if we take it in the context of someone that want to quit smoking, someone that want to stop smoking because the doctor told him it's not good for his health. Smoking is affecting his lungs. If you smoke, at the long run you're going to develop lung cancer and you're going to die. Most of the time, bringing it or presenting it like that to patients or to those smoking, it doesn't work in the long run, because a study have proved that whenever a patient show up in the hospital, most of the time doctors use an emotion called fear to try to help those patients or to try to make patients stop a particular habit that's affecting them negatively, by telling them if you continue smoking you're going to die. If you continue drinking alcohol, it's going to destroy your liver and you're going to develop alcohol hepatitis and you're going to die. So most of the time the question some scientists ask themselves is, why is it that it doesn't work in the long run? Why is it that people keep smoking despite that information? The reason is the why is not the right why. The purpose they have to quit smoking or they have to quit drinking alcohol is not the right one. In the other hand, the same story have proved that whenever you present it to the patient in a way that asking him, for example, what are the things he like here on earth? What are the people he love? Most of the time he will tell you, I love my wife, I love my children, I love traveling, I love doing this and that. When you try to relate it or when you try to put it together to present it to the person this way, will you like to die early than you're supposed to, and not being able to take care of your children the way you're supposed to, or not being able to be present as a dad or as a mother for your children, to give them the love they need to help to raise them up to the level where they are supposed to be independent, to give them enough of love, enough of care, because you die early as a result of you smoking and destroying your lung, as a result of you drinking alcohol and destroying your liver. Most of the time they tend to think about it and they tend to take a deep decision in them related to that why, related to that reason they have to quit this particular habit. And patients that take decision to stop smoking or to stop drinking alcohol in the basis of this, in the basis of looking at the people they love, looking at what they want to accomplish in life, looking at the things they want to make sure they accomplish here on earth before they die, they turn out to quit smoking faster and for a longer period of time than those that we ask them to do that as a result of fear, or as a result of fear. So it gave us an idea on how the why is important for you to develop the right habits or healthy habits that's going to impact your health positively, or to stop the wrong habit that's going to impact your health negatively. So now what is the why? The why, as I earlier said in the beginning, is the purpose of a thing, is a reason you do something, is the motivation behind a thing, is the energy behind you doing something. That energy can be either negative or positive. I spoke about fear in the beginning. Fear is a negative energy, but love is a positive energy. So people that tend to wanting to develop healthy habit as a result of love, as a result they wanted to impact their world positively, as a result they wanted to be healthy so that they can help others, they turn out to develop those habits faster and consistently for a long period of time, and they turn out to be healthy in the long run. Why? Because the why was defined clearly, and the why was backed by positive energy. So I want to ask you this morning, I want to ask you this evening, whenever you are listening to this video, what is your why in life? What is your why? What is your reason for living? What is that thing you want to achieve here on earth before you leave? You know, God sent you on earth for a purpose. He sent you on earth for a reason. There's something you have to achieve. There's a problem you have to solve for the humanity. There's a contribution, a positive contribution you have to bring to your community, to your nation, to the world, that is going to make the world a better place. So I ask you, what is that why for you? If you discover that why, I bet you're going to have the motivation enough to be healthy. You're going to have enough motivation for you to develop healthy habits and have a good physical body, because this body is a license for you to be here on earth, to be able to achieve those dreams, to be able to fulfill that purpose, to be able to impact others positively. You can't do that if you're lying on a sick bed. You can't do that if you are lame because you're amputated as a result of diabetes. You can't do that if you are hypertensive and the little thing you have to do, your blood pressure rise up, and you can achieve that as a result of those chronic disease that you develop in the long run because of negative or wrong healthy habits. So clearly state your why. It can be because you want to see your children growing up and raising them properly, giving them enough love, enough care. It can be because you want to impact your world with the gift God has given you. So define it clearly and make sure that is the energy that is backing everything you're doing, especially with regard to your health. And it's going to be more easier for you to develop healthy habits. Thank you for following this video to the end. And one more time, if you are not yet subscribed to this channel, I invite you to subscribe. Click on the subscription button and activate the notification button not to miss any video I'm going to read on this channel. See you for the next video. Bye.